All right. So hopefully this is going to work now because we want to share that again with you. So we're going to talk about dystocia management in small ruminants, and I'm just going to skip to these slides that we already talked about last time and go to, I believe, the last slide. I stopped. And this is important for me when we started working on the doe, and we talked about the stages already, the doe or the ewes in labor. Even if you're in a barn, even if you're in a muddy area, even if you're on the field trying to pull a baby out of there, and even if you're very, very busy and stressed, try to keep it clean. Okay, try to have clean hands or wear gloves. I know it's difficult to wash in the field your hands, but have a set of gloves somewhere. I used to have in a cabinet my kidding stuff that was easily accessible, so I didn't have to search anywhere, and make sure it's all there. And then the other question is, how big are your does or your ewes, and how big are your hands? As a female, I think we have certainly an advantage that our hands most of the time are somewhat smaller than some of the gentlemen in the group. But I had it when I had very young animals with dystocias because they were bred inappropriately, that I couldn't really use my hands very well because they were too big. I'm actually using I have a size 7 in gloves, and I had students working with me, they had like a size 6, and I just trained them when I was out with them to help me out in very small does, because I just physically was unable to go into them without hurting the doe or the ewe. So the other thing is, I like to try to keep it clean, especially when we pull those babies. Their immune system is not yet there, right? So I don't want to have their mouth, right, hitting the ground in dirt and mud in fecal matter. So I try to put a towel down there right where I work. I try to put a pee pad down there. Pee pads are easier for me because I just roll them up and throw them away. Costco used to have those extra large pee pads I really loved. They were fairly inexpensive, and I could get a big package of them. I think they changed a little bit the sizing. It seems to be smaller now and also not as padded, but they're still better than nothing. Or you have towels. The difficulty with towels, in my opinion, is I have to wash them, and I don't want to wash them necessarily in my own washing machine. So there's my limitation. One of the things when you do pull babies, or when you check out the mom, the dam, there's never a shortage of lube. Please use lube, like a lot of lube, because it will make it easier for you, but it also will make it easier for the ewe or doe. If you go into an animal that has already broke the water bag and has sitting there for a couple hours or even longer, it might be quite dry, and it gets really more difficult. I like to use a little bit more expensive sterile lube. There is also J-lube available, which you mix up in a bucket and you can kind of pump it in. I have a big syringe I use for horses to flush out their mouth, and I just use that one for pumping the lube with a little tubing system into the uterus as well. I do that sometimes with very difficult dystocias where I need to have the uterus a little bit expand even, but you have to be careful with those things, that you don't put in a uterus that may be ruptured, that lube, because J-lube can be toxic. Or if you think this doe or you may have a C-section, I wouldn't use that lube. I would just use the sterile lube, because there is some evidence that if it goes into the abdominal cavity, an animal can die, and not much is used, or not much needs to be in the abdomen, that it could be toxic to the animal. The mechanism I don't think is understood, but that's something I'm very careful about. So if I know it might be difficult and C-section is an option, I'm probably not going to use a J-lube. I'm just going to use the sterile lube just for the safety of the animal. And then be gentle. That's still a uterus. It's pretty thin. It's not a cow uterus. And even with the cows, we have to be gentle. The uterus can tear. I have seen does that just from pushing alone have torn their uterus, I remember a very fat boar goat, just a little bit over a year, show goat, beautiful, but very fat animal, had just one baby, and she pushed so hard, we couldn't get it out. We had to do a C-section, and then in C-section, we could see that there was a ventral tear on her uterus where the hip basically, the head hit the hip, and it opened it up. So if you wouldn't have done C-section, this tear would have been easily missed, and this doe might have had a peritonitis that could have caused her to pass. So that's something to keep in mind. Those uteri are fragile, be gentle with them, you know. And then the other thing is, which is always something to consider, if the baby is not in the correct presentation and position. That means if the head is not there and the two front legs, or you only feel the head, just don't pull on that. Just because there might be enough room, you need everything together. It needs to be in the right position to be able to pull. And sometimes, you know, if the presentation is even wrong, that say it's not an anterior presentation, the head is there, just the hind legs are there, that's still okay, because most of the time you have enough space to pull them out. But I don't want you to pull just on one hind leg, right? And we will talk a little bit more about this. But if you pull incorrectly, it can hurt the baby, it can cause damage to the your doe, and I would not recommend that. And then another really important thing, because I feel like people get carried away. Put a timer on your watch. You know, now they have all those Apple IDs or Apple watches. You just say something to your watch and it's, you know, gives you a timer option as well and things like this. I guess Alexa in my house, you know, and I had Dystocias in my house, so Alexa could be helpful too, I guess. But set yourself a time, and or ask a friend when they're helping out or something, and see if you're progress in 30 minutes. I don't want you to work on your animals for an hour or two without progress, because A, it's going to hurt the animal. B, the outcome will actually be worse, and you might lose the babies. So that is not a good idea. If you don't progress in 30 minutes, and I teach that to students, I teach that to young veterinarians, because I have seen it even in veterinarians when they hold a long time without progress, exhaust themselves, exhaust their resources, and nothing is won. Just frustration on both sides, owner and the veterinarian, plus the babies could be suffering from that if they were still alive. So if you don't make any progress, stop, take a break, drink a glass of water or whatever you want to drink in that moment, and reconsider your option or what you could do differently in this case. Okay, maybe you need to have more lube. Maybe you need to get the right presentation. Maybe she needs a C-section. Maybe you need to ask a friend. Maybe you need to call a veterinarian. Okay, so give yourself some time that we're not exceeding for like 4 or 5 hours. You know, I had calvings, for instance, when I remember I drove out to this older couple, really nice couple, and they were trying to pull a calf for 5 hours. So I go in there and I pulled it out in 15 minutes. The calf was dead at that point. So if they would have called me earlier, we may have had a healthy life path. So that is, you know, not to scare you, but also to make sure that you understand that it's really important to time yourself. And I see baby goat and I get so easily distracted. So I'm like, oh, baby goat, butterfly. Thank you, Deborah, for bringing this little baby with you today. That's cute. So anyhow, so I got easily distracted. So that video I think I showed you last time, I'm just going to skip this one, right? You saw this one, I believe. Did I not? I thought I did. Yeah, I think I did. So let's skip this. So let's go to the actual, let me see if I can move this little screen away so I can actually see it. So the abnormal presentations and positions. And so when we talk about presentations, it's basically, is it forward or backwards? Okay, that's a presentation. And then the position is the abnormality of where the head is, the limbs are, and things like this. So and this one, I hope we could do a little bit more interactive, you know, but I can't hear you. So let's see how we can maybe manage this anyway. So these are calves, but the same difference in goats. So don't worry about the species. But you can see, you know, usually a calf or a goat, lamb, it should have a head and 2 legs in the birth canal, and you should be able to pull. So you see that there's all kinds of different positions and presentations. So this is a anterior presentation, we call it. This is a posterior presentation. And then there's a difference between dorsosacral, which is this, or basically upside down. And in humans, they call it sunny side up, right? So this would be the human equivalent for sunny side up. But you can see that the head could be back, you know, the legs could be back. And why are these difficult to correct? They can be difficult because they're trying to push and they push and they push and nothing happens. And they just cause trauma to the uterus. They could cause trauma to the babies that will be stressed. And which one of those positions do you think is the most difficult to resolve? We can maybe do hands. This one, this one, this one, this one, this one, this. I see no hands. This one. Okay, we have 2 hands for breech and this one. That's difficult too. So in calves, I would 100% agree that this one is the most difficult one to true breech, which is really just a tail and the front leg, the hind legs are forward facing. They can be extremely difficult. I think in small ruminants, I can correct these easier because I can push and manipulate the butt a little bit better and retrieve those legs a little bit better than in calves. For me, to be honest, this one and that one can be extremely challenging on small ruminants. And for 2 reasons, the head is either back or down. You don't have enough space because you have multiple little babies behind there. You have a hard time, especially here, lifting up that head over the pelvic rim without hurting the doe, without rupturing that uterus. And that can be quite tricky, especially if you don't have a lot of lubrication, don't have a lot of space in there. Those, in my experience with small ruminants, I feel like is a little bit easier, to be honest, because I can reach a little bit better that hock and retrieve it, versus those, when it's really crowded in there, it can be challenging. All right, let's go. Hold on, we have a chat. Oh, just 1 day old. That's cute. Sidetracked again. Yeah, let me see if I can go to the net. So this is the tricky part. I wanted you to be interactive. I wish you could, maybe you guys can try to call in, or Dr. Michael can help us. So with the head back, how would you correct these? So you have only 2 front legs, right? And the head is back over the shoulders. Maybe if you guys want to unmute and tell, then Dr. Ashlyn has me on speaker, so I could potentially hear it. Robin can maybe. Dr. Ashlyn, can you unmute your phone?
I would may have to push it back a little bit, but you got to get your hand around that head and bring the nose forward. And that's, I've had a couple of those this year, and it was hard to, it's hard to know what I was feeling at first, because that neck and the head, but once I figured it out and got the head forward, then, so I don't know, there's probably more to it than that, but getting the nose forward is the thing.
So Robin says to that she push the kid back, or the lamb back, to kind of get more space, and trying to kind of hook the head to kind of bring it around.
Okay. So when you bring it around, Robin, how do you hold the head?
Well, the other hard thing about that is, though, usually, like, I had almost all twins so far, and so not really knowing for sure that I had the right 2 legs, you know, when it's already, when there's already a problem, it's like, going in through under the leg and feeling the elbow and coming up around and trying to make absolutely sure it's the right lamb. But pulling the head forward, and then I've been able to kind of keep my hand on top of the head to keep it coming forward till you run out of room. That's what I've done.
Yeah, that sounds good. And I like that point that you have to be sure that it's the same lamb, okay, or kid. And that can be tricky. And sometimes I go in and I think, oh yeah, it's one. And then I'm like, wait a minute, you know, and then I realize I might have two different babies in my hand. So you need to make sure that you have two front legs, right? And not a hind leg and a front leg can be confusing too. And we will talk a little bit about that in a minute too. B, that is from the same lamb or kid. And then you have to gently get it over. What helps me is what Robin described as well. I cup the head with my hand. So I go in with a flat hand and I cup the head. The forehead is basically underneath my hand. And I cup it that way that the teeth will be underneath my hand kind of too. And then I move it up. The difficulty is if the head is backwards and pushed up somewhat to get that motion going, or to retrieve it. So I push the legs actually back in the uterus, so I have more space, and then I do that movement. So I'm basically, my left hand pushes them in and my right hand is moving the head at the same time. If I can't get to the head easily because it's a big lamb, there's not much space, so I will put more loop into it so I have a little bit more room to work with. That might help. And then the other thing I really like to use is those plastic dog leashes your small animal veterinarian has. We do carry some nylon leashes. I don't know if Dr. Ashland has one close by, but basically these one loop nicely around and I can help it that I can pull on the neck at the same time while I'm rotating the head to get a little bit more leverage without obstructing, you know, the baby or something like that. Or if it's dead, then it's a different story. Then I don't worry too much about those kind of things. But those dog leashes are nice because they are either nylon, I believe they're nylon, and we can wash them easily. They stay clean instead of, you know, like sometimes people use like dirty twine off their bales and, you know, later on. I don't like that. So I usually wash them, put them in Ziploc bags, and then I have them available for any kind of dystocia we do. So with these ones, you always have to be careful as well with the teeth that you don't scrape the uterine wall. They have the bottom teeth a little bit erupted. That could be a problem, okay? And then we have one leg back. So in those cases, you know, again, we have an anterior presentation. We have the head forward, one leg back. You push the head and the leg gently back into the uterus, and then you grab the leg where the couple joint comes. We call it the front knee. It's not really a knee, but you know, for easy understanding, we call it a knee, and you pull it up at that way. So you push it back in, and then you just pull on it. I cap basically the hoof, and I pull it up. Again, I make sure while this motion comes in that I don't scrape the uterus with that, because those little feet could be quite sharp as well. Again, you need to make sure that you have enough space in there, okay? And sometimes if I don't have enough space, again, my nylon leash comes in really handy. I loop it around the front knee, the carpal joint, and pull it up. So I have a pull-up motion and push it back in a little bit, and then I cap it, if that makes sense. So it's like a three-way motion, really, because I get it up a little bit, and then I cap it, and then push it in a little bit. The head and the leg. And then I get both legs and the head together out of the uterus. That makes sense. Sometimes you really have to do it to understand what I'm saying, you know, but it comes almost natural at one point, how you grab them and manipulate them to get them out. So when I do them, I don't even think much about it, but I had always students with me to train. So then you think a little bit more about it, what you're actually doing. So upside down, one leg back. A lot of times I rotate those babies into an anterior dorsosacral position so that the sunny side up position changes, right? because what happens is that motion is going to be really difficult. And those babies are easy to turn, I feel like, when it's not too crowded. So I still go ahead and I pull the other leg first. So I have both legs first in the right position. So I push the baby a little bit in, pull the one leg that's back up. So same as it in the other slide just before. So I just grab it on the foot and push the couple joints a little bit down, and then this one up. And then once I have both legs, I can kind of twist them. So I cross the left leg over the right leg, or the right leg over the left leg, it doesn't matter. So I twist them, and then I rotate the whole body with that motion. So I twist them over, and then I rotate the body by holding the head and rotating the body with my hand, if that makes sense. And that way they're gonna go into the anterior position. I have pulled them also upside down when I had an experienced doe with a large birth canal. It was not necessarily a problem if I had like a bigger litter of 3 babies or 4, and they fit through that as well, upside down. Sometimes, you know, that works as well. Okay, so what do you do with the breech one? Any ideas? What would you guys do?
Well, I
Well,
think when you get those legs, either if you can't turn it around, you gotta get the back legs.
Yeah, I agree. If you can turn it around, great, but if not, grab the back legs and bring it out.
Yeah, you can't turn those around usually. I mean, I usually don't even try to turn them around. You know, the easiest is really first you're going to be startled because you're not sure what you're feeling. You think you feel maybe belly or so. So then don't panic, find your way around, make sure you understand what you're feeling. You get a tail, then from the tail you orient yourself to the 2 hocks basically. And then what you want to do is you push that baby further in. So I push the butt in. While I push it in, I go with my other hand and try to pull those hocks up. It's like this motion. I pull it in and up at the same time. Again, if I can't get a good grip on my hocks, I'm going to put that little nylon rope or leash around their hock and pull it up first and then back. So again, you need a lot of lube. That will help you, patience, but rotating usually don't work for me, you know. So those usually when we have larger size litters, I don't think it's that hard. It becomes harder if you have a doe that just has a singleton and she's dry and doesn't have a very wide birth canal, because now the hip comes out first. It shouldn't, right? The head is almost like sliding in like a triangle and opens it up for the hip a little bit more. Now in those cases with that, especially in show goats, or even I had a breeder that has very big lambs, they're show lambs as well, extremely big lambs, those can easily get stuck then as well, you know, because the hip is going in there. Then when I have it corrected, I rotate again. Remember, I cross those legs to rotate the body. So I rotate the hip so that the hip is not going in a straight line out of the birth canal. It goes in an oblique way, because if you look at the hip is actually not round, right? It's not like this. It's not equally in diameter if you look at the horizontal and vertical plane. So it's a little bit more oval shaped. And if you look at the hip in an oblique way, you have the largest diameter. So that's the idea when you have like a big lamb, a big kid, and you need to get that hip through it, then you rotate the hip of the baby so it obliquely goes through the birth canal. Okay, and that helps when you cross those legs over each other, you know, and it doesn't matter if it's front legs or hind legs, you can rotate the body that way, you know. Okay. Yeah, and we talked a little bit about this. I think Robin mentioned that earlier. You know, how do we know that we have just one baby, you know, and not 2 babies in the birth canal that both are trying to come out? Maybe you have legs and a head of someone else. So you have to kind of follow up first. Do those 2 legs belong to the same kid, to the same lamb, or do we have 2 there? You know, that can happen. And then you just have to untwist and decide who I'm going to pull first. The one that I'm going to pull first stays in that position. The other one I'm going to push back in. So the other one needs to go out of my way first before I start manipulating the one I chose to pull. Okay. And again, I need 2 feet and a head to be able to pull appropriately, and not 1 feet of one lamb and then the other feet of the other lamb. That's usually, it's not going to work very well. Even though I think I had a colleague who pulled calves once where they were, I think, twins and fairly small, and I think he pulled both at almost the same time. So because he didn't realize it, you know, but it was very struggling and difficult. So we don't want to do that. It gets really confusing. And this is, again, I don't know, I like to emphasize that with everyone, you know, we talk about dystocias, give yourself a time. And if you can't get it out in X amount of time, re-evaluate the scenario. Do you really have the right legs in your hand? Do you really have a head there, or is it the head of another one? Is that maybe the reason why you're not progressing? Do you have enough space? Is your hand small enough? You know, is the doe already exhausted? You know, is she helping you or not? Or is she maybe pushing so hard that you can't progress, right? Because she is so uncomfortable. And I had it before when they pushed and pushed and pushed, and you cannot manipulate them very well. You know, it makes it extremely difficult. Then I would decide, you know, do I need now another plan, or will I be able to get them out this way?
Dr. Anita,
Okay.
is
So,
there
and then is
any-
the questions. Call
Yeah,
a friend. Call your
is
vet.
there-
I always think it's better either an experienced friend, you know, who maybe has a experience in pulling babies and whatnot, or, you know, certainly your veterinarian who should have the experience as well, you know.
is there any indication other than just plain time where the babies might not be getting oxygen, or the placenta is separating, or something where they're more at risk earlier than the 30-minute timeline?
Yeah, so yes, there is a little bit, but it's always very unpredictable too, I have to say. You know, I had it when I thought the babies are pretty stable, and the second we pulled them, or we had a C-section, they were dead, or they died in the process. It's very unpredictable. I had lambs that got stuck with the head in the birth canal, and their head was like big as a balloon, right? And the tongue was swollen, and I thought, oh my, right? And pulled it, and they were okay. And others deceased in the process or died within just minutes being stuck. It depends a little bit, I think, on the several factors, but also how much can those babies handle. And this is a sad one, but I had, you know, I think it was like a 1 a.m., 2 a.m. Dystocia in some lambs. And if they would be on this call, I think she wanted to be on this call, but I don't see her. But if she would be on the call, she would probably say, yeah, we remember those days. I had a really difficult dystocia. We always had difficult dystocias at this place. And when they called me, I knew it's going to be trouble, right? Because they're pretty experienced. And if they can't get it out, it's hard. And C-section was not necessarily an option. It was really difficult. I got him out, and I just had those lifeless lambs, and I'm like, yeah, dead, right? And out of, I think, 3 or 4, the last one was still alive. And I put it on my little pile of deceased babies, and they're like, wait a minute, it's moving. And that was a huge surprise. So sometimes it's so unpredictable, right? But certainly time is important. The longer you mess, and I say mess, but the longer you manipulate and you don't progress, it will be, the prognosis is less for the babies because they're more stressed.
Is there any indication we can get from like water breaking, or in any other part of the birthing process where we say, from this point, I shouldn't do more than this because the placenta is going to separate and they're not going to have oxygen? Or, I mean,
yeah, if the water broke just recently, I don't worry about the time as much, right? Then I might go for an hour as total or so. But if the water bag broke like 6 hours ago and you just notice now they're dried out already, they're stressed already, I think your prognosis decreases. Or the water bag breaks and you see that the meconium staining has happened, so they were stressed already in uterus and they defecated in there. So that would be also an indicator. But I
Okay.
mean, the earlier you intervene, the better. So when you have kidding or lambing season, I think it's very important to check them frequently. I had cameras in my house, you know, so I saw the pen where my does were that were due, so that I could, instead of getting up every 2 hours, I looked at my camera every 2 hours, you know.
Yeah.
And nowadays it's a little bit easier, but otherwise I would go and check on them frequently, because the more often you check and you pick it up earlier, the survival rate will be higher and decisions can be made faster. And there's not a, you know, one rule fits all. There is different factors that play a role. And I think you have to be very cautious of, you know, how much time you really give. I'm more of a person that if you don't do what I think you should do in that specific period of time, I will check my dose and make sure they're not having issues. And in the first presentation, we talked about stages of labor, and they have specific time periods as well, right? So if we are in active labor and you're not progressing as a doe, I will check. I'm not going to wait 6 hours to see if she maybe gets it out. Once she starts pushing, and for instance, in an experienced doe, I personally go after 30 minutes if she's not progressing. I will check them. And I make sure everything is in order. Her cervix is dilated. Okay, baby's coming. Maybe she needs a little bit more time. I give her more time. And then if she's still not progressing, another maybe 20, 30 minutes, actually probably earlier than that, I will intervene and I will just pull those babies if the cervix is open, if the baby is there, right? So those factors make a role. If she needs a little bit of time, unexperienced dose or first time, I will take a little bit more time. I will be a little bit more patient with those. I will give them a little bit more time, see how they're doing, you know, giving them the time to dilate their cervix. But I'm certainly checking more frequently than maybe in a commercial outfit. But yeah, it's important to make decisions in a timely fashion, you know, one way or another.
Do you think,
I don't know if that's
if you're in question, so, you know, sometimes you come across your doe and you don't know how long she's been in labor and whatever. Do you think there's much harm to just like go in and reach in and check?
Yep.
If you're not quite sure,
Nothing
I
wrong with
mean,
that. I think if you know she is in labor, or you know, sure, I rather feel once too often than not once enough.
okay.
But you have to, my computer says no low battery, but I plugged it in. Hold on, guys. Plugged in. I plugged it in, so let's see. Hopefully I'm not losing you guys. Computer. Let me see my battery if it charges now. Yeah, it's charging. Okay, we all good. We all good. That gave me a little scare. I know I clicked a little bit. Yes. So I would check, you know, just make sure that you have clean hands and that you use lube, and, you know, and I would check the cervix if everything is okay, or do we have a dystocia? Maybe that you just have a breach and they can't push it out. You know, maybe they give up. I had it where clients said, I don't think she's in labor. And then when we went in, or I went in, they were in labor for a long time. It was just missed. So
Right.
they started to be in labor and they just gave up. Those does became tired and they just stopped pushing. So it could have been middle of the night, let's say 10 o'clock, you're already in bed and you don't see the whole pushing. And at 8 a.m. when you come out and check on them, they stopped.
Right.
You know, they might be off, they might be not eating, but you don't think much about it because they don't show active signs of labor. So it's really important to watch them closely, I think. you know, and it makes it hard, but especially if you have a job and you do other things as well. I mean, I had interns come out to my farm on labor watch, you know, not everyone has interns. I totally understand that. But it helps nowadays with the cameras to have them set up and to be able to check your phone even from work, see what's going on, you know, is someone in labor, or is something happening here? It makes it really a little bit easier. But yeah, the more you check, the better it is really for the outcome, you know.
Okay.
Not sure why this is going back. Okay. All right, so if you cannot hold them and you call your veterinarian, then the question is, can we do a C-section or phytotomy? You know, phytotomy is basically where you cut a kid or lamb into pieces. Sounds horrible, and it is somewhat horrible, to be able to get it out. Most of the time in those cases, it's just 1 or 2 cuts. It's most of the time removal of the head. When I have, for instance, a dystocia, legs back, head outwards, right? And you can't push it back in and you can't get it out because you don't have those 2 legs. So then in those cases, I will cut the head off to be able to push the whole body back into the uterus, lift up those 2 legs as we described earlier, and pull it. Importance is, if you do so and the spine sticks out, you need to cut that spine, okay? Because that spine now from cutting it is sharp and it could lacerate your uterus. So that has to be done with 2-hand motion again. One is taking care, one hand is taking care of the feet, the other hand caps the spine. That's really important. That's probably the most common cut I'm doing. And then otherwise, I had it where I removed one of the legs. So for instance, I have 1 foot out, 1 head out, and there's no space to push it back in. Again, I just don't have the availability. Then I might cut the leg off, or even inside when I can't just reach it, I cut the leg off. Those cuts, I do not recommend for clients because you can cut into the uterus. We have specific equipment for that. And certainly that's something your veterinarian should do. And depending on the experience of the veterinarian, they may prefer to go for a C-section versus a phytotomy. I mean, if the head is out, probably not, but if there are other cuts necessary because they're challenging and they can be really hurting your doe, if the cut goes into the uterus, it could be the end of the life. However, if there is no option for a C-section due to multiple reasons, maybe, you know, financially it could be too expensive, you know, the value of the doe, the babies are dead, they might be dead for a couple of days, right? C-section is a little bit more risky on those. Then we may be trying to do phytotomy first. Certainly for those kind of decisions, it's important. Do we have live lambs? Do we have live kids? Is there enough space? Is the cervix open? If the cervix open not open, it doesn't matter. I can't get him out on the birth canal. I can try to dilate it, and I have done that a couple of times where I just took my time and dilated it. But if they do not dilate with my method, I need to make a decision. What are we going to do here? Are we going to do C-section? You can't leave the babies in, right? Especially if, you know, the babies are still alive, you need to make a decision quicker than later, right? And then obviously in some scenarios as well, you know, how stable is the animal? You know, if she's in labor for several days, and yes, that happens too, then she might not be the best C-section candidate. You know, it might be better to just open her, not open her up, just go on the vaginally if you can, and try the best you can to pull them. The babies, I had it when they were dead for 2 days or so. There was already the hair coming up, stinky, summer in California, you know, all is rotten already inside. And then to do a C-section in the field conditions might be a little bit challenging, you know. I mean, can happen, but it is challenging. So those things will all play a role, you know, when we discuss those things. So it's not a cookie cutter system here. It really depends on multiple factors, but I do recommend to my clients when I'm out for dystocia, if we do phytotomy, or if we try to pull them, or if we do the C-section. My decisions I made within 5 to 10 minutes. So I'm know within that time period if we need to go a different route. I usually don't need 30 minutes to decide what we're going to do, because I can pretty quickly determine, is this a case I can pull, and then make a decision.
What's an
All right,
episiotomy? No. Episiotomy.
all right, and then
Quick
obviously,
question,
yes.
what is an episiotomy?
Oh, sorry. So that is basically when you cut into the vulva. So especially in younger first timers, they dilate their cervix nicely, but then they get stuck in that tight little vulva. So the head is there, the legs are there, and things can't come out, right? And then I make a cut through the vulva to open it up, to give me an inch or something like this, and have that space to let him come out. That episiotomy has to be done carefully, that you don't hit one of those bigger vessels on the rectum, right? You know, or on the vulva that comes down. So usually, I prefer or recommend a vet do that versus an owner, just in case. Because if something bleeds, we always can suture it up too. A lot of times, depending on how big my episiotomy is, I don't even close them up. I let them heal by second intention over time. I just give that doe some antibiotics. And we need to ice that vulva afterwards, because it's going to be ouchy. Okay. So
Does that
but
affect-
it gives me space, and I have pulled babies that way nicely.
Does that affect her ability to have babies in the future?
No, she might get a little bit scarring in her vulva, but honestly, if it's done right, and I have done pretty large episiotomies going fairly deep in, I didn't have any clients complain later that they had difficulties giving birth later, you know, so I'm not too worried about that, to be honest. That is usually not a problem. It's more of a problem if trauma happens in the back, so uncontrolled ripping of the vulva, uncontrolled ripping of the vagina. That is where I see that they may have breathing difficulties because of the scar tissue, you know, once they get bred, it's hurting them. They don't want to let the buck on there, because the buck has to go basically through that scar tissue to break it down, or it gets a little bit more narrow. But from the episiotomy itself, I don't think so.
Okay.
If, you know, you go for a C-section, or even, you know, yeah, for a C-section, you need to really think about also surgical risk associated with the procedure, right? We're on the field a lot of times. It can be dirty. She could just push, she could flip, you know, she could roll in the dirt by accident. That's certainly something to consider. We are not in a hospital. I mean, it would be great to have it all sterilely prepped and so, but reality is it's not, you know, and reality is that it can be a little bit tricky. I hear a lot of people say, well, the C-section will influence their breeding. Honestly, the first doe I was telling you about with that, she ruptured her uterus from that one single baby. She came back the next year with a dystocia again, and she was bred. So, I mean, you know, even we did a C-section. I think they can rebreed. It might be in some cases a little bit more tricky. Also, if you had dead feti, you know, dead babies in the uterus, that changes the uterine lining, that maybe leads to inflammation and disease versus actually the surgery itself. If you have a good technique for the surgery, if you have live babies and didn't wait too long, I think the prognosis for rebreeding and health is pretty good, actually. However, remember, the doe is compromised. She might not be eating that well. Her milk production takes a toll on her. You know, it's hard on them. They need a lot of TLC. They need the extra care. They need the extra feeding. And it goes back to, don't have a doe go skinny into labor, right? She needs to be already in a good body condition when she gets bred, when she's pregnant, and when she's delivering it. I can't give miracles out when a skinny goat is in front of me. They will have a tougher time with everything. Deborah has a question.
Can you hear me at all?
Yeah.
No. Yeah. So we had we don't breed, but sometimes we take in pregnant animals. We're a rescue organization, and we did a C-section this year, our vet did, and it was successful, but we had to give the doe oxytocin injections for 4 days to get her to bond. I guess because she was sedated and to help her let down in her milk. So is that pretty common with a C-section?
There are two different opinions about the oxytocin and post C-sections. So there are veterinarians like me who like using oxytocin after even C-section because it helps to contract the uterus. And there are other veterinarians that are worried that if you use oxytocin after C-section, that will pull on the incision and could tear it. So I think that's a very valid point too. So you will see a few veterinarians that will not use it, and I totally get it. I use oxytocin post-surgery because I'm pretty confident about my incision. So I'm not worried about it, except if I had a really bad uterus, I might choose not to. So it's a little bit dependent. Oxytocin also will not work on the uterus after 24 hours anymore. So then I can, you know, the receptors that are, you know, let the oxytocin do their job on the uterus will disappear basically after 24, maybe 48 hours. I think it's 24. So thereafter, if you want to use it for milk letdown, it's pretty safe, I think, and that would help. But we still need to remember for the milk letdown, you still have to have, you know, the right feeding, the right environment for the doe, and that makes it challenging. Some don't get into milk very much.
Right. Okay. Thank you.
I still think with those babies that are born through C-section or even pulled, the most important part, I think Dr. Michael probably explained that already, is the colostrum, to make sure I tube those babies right away. I make sure they get the colostrum to start with, because they're already stressed, you know?
Yeah, we did that. We milked mom and turned around and fed it to the kids within an hour. So, and they're fine. So
that's perfect. Yeah, so that will be important, you know, and then obviously when we go for C-section, it will be more expensive, you know, will be, and then if we have, for instance, like hobby breeders, or they just use them for, you know, for the meat, it might be not valuable, or not valuable, but not economic in that sense to spend X amount for a C-section versus trying to pull with all means. And there is also sometimes the discussion, and I have done that before, when the actual baby was more important than the dam, and the C-section wasn't an option, that we do a terminal C-section basically. Okay, that's basically we just cut the baby out while the mom is sedated, she's not going to feel anything, and then euthanize her in the second we have those babies out. Okay, that can happen too, or the mom is very compromised, she's already so sick, we know the baby's not alive. For instance, a doe that has severe ketosis, it's down, not doing well, then we maybe elect also for that kind of C-section to save the baby, sacrifice the dam for the babies. So those things occur as well, but it really depends on the case. Hopefully not, right? So
is there anything,
right, that we never go into ketosis and things like that?
is there anything special that you do with the babies in that case?
When we do a terminal C-section,
Yeah.
yeah, I give them colostrum. If the dam is sedated, we need to make sure that the babies will be sedated too, that they will come out of that sedation, right? So if we think they're weak, they might be just still sedated, so we give them a little bit of time to recover. Oxygen support, if it's in the hospital, is important, you know, warmth, keeping them warm is important, and keep them then normal glycemic, so they don't become hypoglycemic and weak, and then too weak to suckle, because it becomes a vicious cycle. Hypothermia and hypoglycemia kill a lamb kid, and we need to by all means avoid that. Colostrum is very important if it's a high valuable animal. I recommend even to do PCV and total protein after 24 hours and check if they got enough colostrum, if they were able to absorb it, and if not, they may need a plasma transfusion. In some cases, plasma is not available in the field, and we can do a blood transfusion that contains some of the plasma as well, really, because it's part of the blood. So that is an option as well to give them a little bit more strength. The way the babies start their life is important. for longevity, you know, for survival rate of those babies as well. Clean environment, again, is important, that we don't have them birth in mud, dirt, fecal matter, you know, so we're not going to get an E. coli infection right away. Their GI tract is open to take up everything, right? Because they're open for big proteins, colostrum, so any bacteria will be absorbed too. Yeah, there's no barrier, there's no protection really. So, you know, when I see them mouthful of dirt or fecal matter, I'm like, yeah, that was probably not a good idea.
Yeah.
Sometimes, you know, depending on the case, I might give prophylactic antibiotics, and there's another topic with that because we have regulatory limitations to that as well. You know, some of the drugs we used in the past are illegal for prophylactic use. So we have to be a little careful with those things and have to consider, you know, what our option with navel dipping and things like this. I'm pretty sure Dr. Michael talked about it last talk, is really important in those babies, and the TLC, you know.
Okay, great.
Right. So preparing for a C-section, this was at Ohio State long time ago, you know. We had an anesthesia tech fully on gas. This was a little bit different setup. Very sterile, you know, mask, everything, and beautiful. Can't even see me. Or this, you know, standing C-section of a very nice doe. The babies, I believe in her case, she actually just didn't carry to term. They just died. She had basically a dead feti in there. They just didn't develop, so she never went really into labor at her birth date, you know. And so she was really mellow, and I can do standing, which I actually prefer, but not everyone is that strong like these. If they're a little bit tired, they will lay down. So it's better to have them maybe slightly sedated and laying down on the side. But this case was pretty nice, to be honest. It was a very nice, clean C-section, and she did really well afterwards. And this is just, again, you know, this is the uterus of the cow, this uterus of the sheep. That was one of the student labs we used to do, and beautiful, clean environment, right? This is how it should go. We cut through the uterus, have exposed the hind legs, and these are the hocks, break down to the membranes, grab those little legs and pull them out, you know, and then we check for more babies. And that's another thing. If you ever pull babies, right, make always sure you have everyone. Go back in there and check if you have multiple babies. Is there a third one? Is there a fourth one? Is there a fifth one, right? Just make sure you have everyone. And then usually in the C-section, I don't pull on the afterbirth, except the afterbirth was ready to come out anyway, because maybe we had a dead fetus or there was already placenta separation. Otherwise, I leave it in, stuff it back in, close the uterus up, close the body wall, and off we go. Okay. But that is here. This is the foot of a calf actually, and the hock is anchored in that incision. We do it a little bit differently. I hock them in there. And this was a very traumatic C-section, and a cow, her name was Happy. So anyone called Happy, Lucky, I don't know, please don't, because they will have a bad time. This was actually a PHA calf, which is a defect. And this calf weighed 130 something pounds, if not more. And we did it on the ground. It was very traumatic. And that was after we pulled a year before, also a deformed calf from that cow, and told her not to breed again. So if your veterinarian ever says, please do not breed again, please follow that advice, because I bet you will have issues again with that. Here's again a sheep, again in the lab where we just cut it. You see a nice cut in the uterus. They actually cut it a little bit more open because they felt like the hip is getting too close to the uterus. So we don't want this to rip. So we open it up a little bit more to be able to retrieve. So the students did an excellent job with those girls. And that was part of the UC Davis lab. I honestly don't know if they still have that, because, you know, sometimes those labs will be shut down due to financial restraints or due to people complaining that we're using animals for teaching purposes. But we need to have those animals, you know, they're bred for the purpose of having a C-section to teach our younger veterinarian what to do. So, you know, they're in the field and be able to perform those procedures for you. So it's really important that we have that training, you know. Post-operative care, I usually, if I have a dystocia that was really dirty or dead lambs, kids, I use some antibiotics. If I have a simple Dystocia and it's very clean, I don't worry about antibiotics as long as I have been clean and nothing happened. And then we can use the oxytocin as well for to expel the afterbirth. I do think everyone should get some pain medication. You know, one of them, fluniximiglominus which is, I think, in my opinion, a little bit better for those cases. It's better for soft tissue pain. The difficulty is it doesn't last that long, so you would kind of have to give it twice a day, and it's an injection, so it's a little bit limitation for clients if we just leave the medication there, right? The meloxicam, which is also an NSAID, is a tablet, just once a day usually, but I use that more for arthritic pain or other kind of bony pain versus soft tissue pain. You can also use dexamethasone. That's an option too, but the problem is, at least in cows, there are studies that if you use dexamethasone, it will decrease milk production. So if you have a high producing doe and you want to keep it up, I may not choose the dexamethasone in those cases, just in case. And then they do need some fluid administration as well, you know, supporting the cardiovascular system, either IV or sub-Q, or there might be ketotic, things like this. And then additional pain medication, even for the anti-inflammatories, are pain medication. But there's, for instance, something that is gabapentin we use quite frequently now. And I do add that now for any kind of painful small ruminants. But we have to consider in all of those animals, even if they're pets, that we have milk and meat withdrawal times. And that is important, and your veterinarian can guide you with that one. So that is certainly something. Recovery on those C-section girls is actually pretty good, you know, if they don't have any comorbidities at the same time, like fatty liver, ketosis, things like this. If it's just a C-section, they do recover fairly well. Risk associated with that could be, for instance, peritonitis. So if there's some leakage from the uterus into the abdomen, or in surgery, we had a dead baby and we couldn't avoid that something spilled into the abdomen, then we may have a peritonitis, and that's why we should keep them on antibiotics. Retained afterbirth is pretty common as well. So the oxytocin might help in those cases. Putting them on antibiotics and giving them a little bit of time might help too. And then afterwards, maybe metritis if the uterus has some issues. We do see frequently, especially with the C-sections, there's a concern of abdominal adhesions. And if the ovary is involved in those cases, then that could certainly influence our breeding as well. And then wound infections. So that can happen, you know, if it doesn't heal nicely, or they open up the sutures, things like this. And then, like we said, culling due to infertility can happen as well. All right. And I think we had a talk a couple months ago or 3 months ago by Dr. Smith, talking about, you know, the recognition, observation of pain. So even though, you know, specifically sheep are pretty resilient and they don't say much, but keep in mind that they probably experience some pain, and keep in mind that assessing their pain is not a bad idea, or keeping them on anti-inflammatories and pain medication for a few days is certainly a good thing to do. And I'm just going to skip through this because we had talked about it already a little bit. But one of the things is, you know, there is nothing approved for pain in small ruminants or cattle as well. So there is extra direct label use now. I think now we have the patch actually for cattle for Banamine. That might be, but I think it's still the labels for fever and not for pain. So that will be something to keep in mind. You can use it extra drug label, but you need to have basically a valid veterinary client relationship for us to prescribe those medications. And there's a little bit of a regulatory concern about this. And everyone is looking at all the drugs we're using, you know, for all kinds of reasons. But I think we're going to have another talk about that at one point.
Is there
So,
is there
just
any
because we may have like a pet goat or so, if you ever sell her, remember that maybe not everyone has a pet goat, right? They maybe say they're never gonna eat her or so, but it could still happen, especially if you take them to kind of a market or so and sell them. So I would be always careful with what kind of drugs we're using. There are some illegal drugs I never use in companion animals either, because I just don't know whatever happens to them at one point.
Is there anything happening from a regulatory standpoint to help legalize and properly regulate pain management drugs in these animals? It seems to me ridiculous that in the current climate where everyone wants to raise, well, not everyone, but people want to raise animals ethically and humanely, that we don't have an option for this.
Yeah,
So
I
is-
don't know if there's anything right now in place that pushes for those. Maybe Dr. Michael has an idea, but I'm not aware of anything really besides studies that show that more and more studies come out that animals have pain. Guess what? Their babies have pain, right? Like, I don't know, 50 years ago, they were even saying that babies don't have pain. Of course, everyone has pain. So animals have pain too, and there are multiple studies that actually prove that. I'm not aware that there are regulatory change. There is a regulatory change, though, that xylazine is going to be under controlled substances. So that's going to influence our, as a veterinarian. So it goes a little bit more, everything that has a human implication will make a change, but not necessarily if it has a livestock implication, if that makes sense. So
Well-
antibiotics were limited, the usage, some of them, because it had an influence on bacterial resistant strains in humans. So that's the main reason why it was done. So anything that influences humans will have an effect on us. I don't think we are going to have anything majorly happening regarding pain medications in livestock animals, but most of the large animal veterinarians and livestock veterinarians are going extra drug label use. And we just have to have an indication, and a relationship with our clients to be able to do so. And that is why it's important to have a veterinary partner, for your herd, for your flock, so that you can rely on those. And, you do yourself the biggest favor by actually not just calling them once a year out, calling them out more often, have that relationship so that they also trust you more to leave medications with you. And because they know what you're doing on your farm and they know your herd. So
Right.
it certainly has a benefit,
Yeah, I mean, Dr. Michael, if you know any more on this particular topic, because it's important to me as a meat producer who caters to folks in the Bay Area who care about humane animal treatment, which includes, of course, pain management in cases where our animals have pain. If you know any more about this when you're out here next week, I'd appreciate talking to you about it, because it seems to me ridiculous that there aren't options for animals when this is an important topic, or a topic that's gaining importance, I'd say.
So we had Dr. Joseph Smith invited once, and he can come back. He said he would be happy to talk again. He is a pharmacologist, toxicologist, internal medicine specialist, and a large animal veterinarian, really. And he can give us more insight if there's interest about, use of antibiotics and regulatory concern there, plus hopefully can dig into the pain things, unless Dr. Michael has now, other things. She can look it up or can contact Dr. Smith even though during the next few days before she comes to your appointment.
Okay, that'd be good. And maybe, I mean, again, I'll talk to you guys about this, but maybe we get some of the folks involved in the, natural,
Did you want to say something,
humane,
Something?
humane produced meat movement involved
know.
that says we need more tools to help
Yeah, we
manage things.
yeah, I think we do need, it's just getting difficult to get those through, to be honest. I think
yeah,
the
I mean,
focus a lot of times is a little bit differently set than what we like. But the consumer want that, and the organic program excludes that really, right? Because anything that gets treated really has to go in a different strain. There are some exceptions, I think, for some of the pain meds, but I'm not certain on that one again.
Organic excludes it, but as far as more of the natural, your grass-fed, other certifications, and just the basic consumers that want to make sure that the animals that they're eating are humanely raised. I mean, we might be able to find a voice there. Nothing happens overnight, right? But it just seems ridiculous to me that the current perspective is that these animals don't feel pain and we don't have some options to help them when they do. And I know that my customers personally would be devastated to know that that's the current state of events,
Well, you have options if you work with veterinarian, really, because
Well,
you can go extra drug label use on those cases.
I
Sure.
do. I mean, I do because I work with you guys, but just the whole concept. I mean, this fits right into the narrative of people who want to eliminate animal use, right? So the whole concept that these animals don't feel pain, so we're not going to do anything for them, is just an antithesis to what we're trying to do, which says we're going to try to raise them as best we can. So, I mean, I'm kind of getting into my little soapbox, but if there's anything that we can do to try to educate folks and maybe get some advocates on our side to say, no, we need some tools to raise these animals humanely and give them pain meds properly, if they need them. I mean, I don't know.
Absolutely. I full-heartedly agree, and I think we have changed the way of how we practice over the last decade. For instance, we do disbudding differently. We do castrations differently. Our practice is to the point where we sedate baby goats too for the disbudding procedure, because it has been shown that they do recover better. The stress level is lower, or at least we block those horn buds. Castration the same. We give them pain medication. We block those testicles before we ban them. I think I was on one of those goat pages, or someone asked, I think, for neutering some pigs the other days, and someone suggested to ban them. And usually I don't comment on anything online, but I had to give my 2 cents to it that banning would be very inappropriate and not the right thing for a pig.
Right.
So I wish we had more resources for people to understand and change the way also we think about pain control in livestock animals, because it's pretty common practice still that there's no pain control for all those calves, all those lambs, all those goat kids on castrations, disbudding, and so on. So I totally agree, but we in our practice, Dr. Michael does a great job of mitigating pain in the species she's treating.
Yep.
So
Okay.
I have a question. We get a lot of kids that aren't in great shape. Like we take in a lot of boys from dairies, so there's a problem sometimes with colostrum, them getting colostrum. Do you recommend BOCI for newborns, like for everyone, or just generally if you have a kid that's not looking great? Or
I give it to everyone.
okay.
Yeah. Because they're not
so many
going
people,
to
and I
get
get
BOCI anymore, or selenium through the milk, right? When they're bottle feeding. So there's a gap from their stores that they have, maybe from the dam on selenium, that gets depleted over time. So usually where we see white muscle disease is 6 to 8 weeks of their life, because there's a dip in the selenium if they don't, and they're not eating forages enough to really supplement themselves. So I give them BOCI. I might give them a second BOCI shot as well. I don't know where they come from. I don't know how they got fat. That would sort. But if you take dairy goats, and I think that's a different talk. If you buy them from markets, take bummer lambs and so on. I don't know if you have a breeding program, but things like this. But that's a really I think we have it recorded, the CLA talk in Yonis. Maybe go online if you haven't had a chance yet to listen to that, because that's my main concern. I used to take a lot of bummer lambs in from different resources, and then once I started breeding Nigerian dwarfs, I put a total block on that, because I could not guarantee that I'm not getting something diseased to my flock or herd.
Yeah, That's tough. We try and work with dairies that have good husbandry practices and we keep good relationships with them because we got a batch of kids last year that all had crypto from the auction. We didn't know someone was bringing them. It was a nightmare, but so with BOSI, you usually do like 0.25 cc sub Q, not more than that, right?
Usually 1 cc per 40 pounds.
Oh, 1 cc per 40. Okay, cool.
So a baby goat usually, average baby goat probably gets from me like 0.25, sub Q, something like that.
Okay,
Um,
thank you.
And I think, Dr. Michael, did you talk in your neonatal care part about that? But that's not online, right? Because we had difficulties.
Yeah, I couldn't record. That one didn't get recorded, but I have the slides. We could send out the slides.
Yeah, we can maybe send out the slides, or maybe you re-record it with your voice and you just post it online. So anyhow, I think we come to an end. We are a little bit over the time already, which is fine. I just wanted to make sure we finish this. If you have additional questions, you always can reach out to us. You can email us. We have a text only option as well. There is another talk on May 1st. I actually tried to make a poll this time. I don't know if that's going to work even. And we also did very small. Yeah, let me see if do you guys see that? Can you click on it? I mean, we just
Yeah,
said
we can see
or
it.
8 or 9, but I figured might as well see what you guys want. And since you're the ones that are here, you make the decision really. So we can oh, you opening us. Well, we have 2. If someone else wants to still vote, Dr. Michael, you want to vote because you may have to give a lecture. This is your chance to manipulate the system. So I think Dr. Smith said he wants to come back anyway. So I think it looks like we're having on the antibiotics and ruminants and regulatory health concerns. That's probably a good one. So with that, I would say we're gonna see you again May 1st, and hope you had a good time. And sorry for the technical difficulties you experienced.
Can I ask one quick question, Dr. Varga?
Yes, Lisa, of course.
So I wasn't quite sure, but these are very interesting topics and very helpful for folks. I wasn't quite sure if you send out the announcement, can we share these with other people so that they could join these
Absolutely. We share them
conversations?
online. Usually we share them on goat pages, on sheep pages. We share them on our Facebook page, which is open access to anyone and everyone.
Okay.
And then
All
you
right.
can also direct them later to our YouTube channel where the videos will be recorded or
Okay.
posted.
Okay, great. I think there's a lot of folks that'd be interested in this.
Okay, yeah. Share you, they're more than welcome. All right. With that, I end the session. Thank you so much. Thanks for that baby goat. That really was good to see. And maybe next time we bring all our animals into the picture because I love seeing them. I get sidetracked though, so maybe it's not a good thing. But all right, have a good night. Talk to you soon. Bye.
Night.
Do you still need